Hi, everyone. My name is Gary. In case you don't know me, I'm a respiratory therapist or respiratory care practitioner here in Los Angeles, California. I am starting this new series where I am introducing other healthcare professionals to help you guys understand their profession a little more. And if you're a student, maybe this can help you along your journey a little bit. And yeah, so today I have Veronica, DPT. She is a doctor of physical therapy here with us. And I am just going to ask her a few questions about her job, and how she got where she is now, and hopefully give you guys some helpful tips and advice. Okay, so tell everyone a little bit about you, like where you're from, how long you've been a DPT, and such.
Right. So I am Veronica. Like my official title is Dr. Veronica Velasquez, Doctor of Physical Therapy. I've been a physical therapist for a little over a year now. And I work also in Los Angeles, South LA, like Compton area, in a small community hospital. So I am an acute care physical therapist, mainly providing physical therapy for folks who are admitted into the hospital, which is really great. I get to work really closely with respiratory
Yeah.
care practitioners as well. And yeah, I am really enjoying it.
Awesome. So we're kind of like in a similar boat. I've been in RT slash RCP for almost 2 years.
Ooh, yeah, really
Like
close.
in the summer, it'll be 2 years.
Ooh.
Um, but still kind of like that fresh, um, first year type. So like RTs, PTs, we see such a range of patients throughout a day. Um, and I love that about being an RT, is that you're not just like stuck with one patient, and you get to care for such a variety of patients of different age populations with different issues going on. Um, and so how fun is that for you to not only meet and help new people, but kind of do different therapies for each? And can you tell us a little bit about like what a session might include? Because I'm sure you do a whole bunch of different things.
Yeah, so I also just love that I get to go to all the floors of the hospital and
Mhm.
just see all types of diagnoses and patients, and ranging from, just like, well, in the hospital it's typically like young adults all the way to geriatric population.
Mhm.
Um, so I really, really enjoy that. There, like you said, there's so much variety in who I can see and who I can treat. Um, and yeah, so basically, typically a session starts with an initial evaluation of me seeing how a patient moves that very day.
Mhm.
So sometimes it can range from them getting up out of bed and they're already walking within the room. I just might need to help them with a new assistive device, like maybe giving them a walker to be a little more safer, or a cane to get just a little more stability, all the way down to patients who may be intubated still, but they're awake and alert, but
Mhm.
they can't move. I have to do like passive range of motion. So there's a wide range of how much people can move. And really, a physical therapist is there to optimize their functional mobility. How can I get them further along the spectrum to independence with their mobility?
I love that. Yeah, it's so like it's so similar to respiratory, in terms of we're doing different therapies for different age populations in different parts of the hospital. So it's very similar. I know there's a lot of times where I go into the room and the PT's in there, or like I'm in there and they're coming in. And so I totally know what it feels like, to like have to juggle like sharing the patient and trying to do different things, and just treating them differently too.
Well, I definitely rely so much on the RTs, especially if I walk in and patients are on high flow nasal cannula. And like typically, I can't walk those patients, but there's been multiple times I walk in at the same time with the RT, and I'm like, can you help me walk this patient? And they're handling like the high flow,
Yeah.
and this patient like can now walk, when if I didn't have RT there, patient wouldn't be able to walk a longer distance. So it's really fun to get to just collaborate, especially with RT, who can help
Yeah.
you with tougher patients for me.
And it's so important to like, you know, these patients, there's a lot of them are bedbound for so long, and that really does affect oxygenation too. And so it's like so important to get them moving and get their lungs functioning. And it's so funny, I saw your incentive spirometer post on your story, and I'm such an IS like advocate. I'm like, you're not moving around a lot, like you have to do this. Like my patients are going home that are like really on top of this. Like it's such a simple small device, but it works so well.
Yeah. And like I definitely learned that from RT as well. And like at the end of sessions when I'm done with physical therapy, I do ask if I see the incentive spirometer there. I'm just like, do you practice this? Like
Yeah.
are you using this? Sometimes they say yeah, sometimes they say no. So I feel like that's
Yeah.
another way we collaborate. I just like give them a little reminder.
Yeah. So how has COVID affected, you know, your line of work and you personally, like in general, just working during COVID?
Man, working during COVID, um, especially as a new grad, I felt like I was just like thrown into the wolves. It feels
Yeah.
like um, I don't think school really teaches you how to be a clinician during a global pandemic.
Yeah,
So
no.
a lot of um, being a PT during a pandemic is just trying to learn as I go and adapt and just
Mhm.
really try to. I think the big thing is really trying to take care of myself, like emotionally and
Yeah.
mentally. Because I think all of us, like, we have the skills, like we have the clinical knowledge, it's all there.
Hmm.
But I think the biggest thing is that's new to me is like figuring out how to take care of my own self care. I mean, we're just seeing so much sadness and like a lot of death
Yeah.
all around us, and I'm not sure that we were ever prepared for this. So I think the biggest thing that's changed for me is just trying to find out how to take care of myself so that I can take care of others.
Yeah. Oh, I know. It's such a learning curve, and really nothing, no schooling, no labs, no videos can prepare you for just that actual raw experience, you know? And unfortunately, we were thrown in such a time where it's like really it's an experience. But I feel like personally, and I'm sure for you and other people, it's helped me grow like so much, you know, quicker than I would have had to. But also I'm so grateful for that too, you know?
Yeah, I
It's just such a
definitely,
crazy time.
it is. But yes, I definitely agree with you. Like it makes me more grateful. It makes me grateful to be in a profession where we get to contribute during a really scary time.
Yeah, it's very rewarding. It's rewarding. Yeah, it's just crazy. It's crazy. So every physical therapist is a doctor, and I feel like not a lot of people know that. So explain how the schooling process works and how long that takes. Why did you decide physical therapy? Is that something you initially wanted? And yeah, what was your inspiration?
Yeah, so initially, just to describe the process, for all people that want to become a doctor of physical therapy, you have to have a bachelor's degree in anything, and then finish a set amount of prerequisite courses. And then once you get accepted into school, it's a 3-year doctoral program.
Mm.
And then after you graduate, there is a big boards exam that you have to take. Then when you finally pass that, you can finally call yourself a physical therapist. And yeah, so to answer your question, did I always want to be a physical therapist? No, I actually didn't even know about physical therapy until probably like maybe second year of college. So I actually wasn't ever exposed to it until later in my life. I thought I wanted to go to med school. And then I pivoted, thought I wanted to be do something in psychology, pivoted again, thought I wanted to go into something in poli sci and then into athletic training. And then finally, I did some shadowing hours at a physical therapy clinic and really thought that the profession really aligned with what my life goals are, really aligned with what I want to do with my particular like patient care. Um,
Mhm.
and just it just seemed like the right profession for me in terms of my personality as well. So yeah, I think like the big thing I tell people is like it's okay to hop around because you
Yeah,
really find what really vibes with you when you go out and explore.
I love that. Even though it kind of took you a while, it was worthwhile because, like you said, you found like what was fitting for you. And so that's really awesome to hear. So I was snooping on your Instagram, and I guess last year you were doing some home therapy sessions. Are you still doing that? And how does that differ from the hospital setting? And do you have a preference to which one?
So yeah, I still do home health physical therapy as kind of a per diem side gig to make some
Mhm.
extra money because them student loans are so I do that on the side. And yeah, basically, home health physical therapy are typically with patients who have discharged from the hospital setting that aren't quite safe yet to do outpatient physical therapy
Mhm.
and who are typically homebound. So, what we do is go actually into the homes and provide physical therapy in the homes. And it's very similar to what I do in the hospital. I'm still analyzing how the patients are moving at that time period and trying to push them further into more independence and ideally to push them to be safe to leave the home so that they can go to an outpatient physical therapy clinic. Um, and yeah, so that's basically home health physical therapy.
Mhm.
And like whether I like one or the other, I kind of like both. They kind of serve my interests in different ways. Like the
Mhm.
hospital gives me a lot of collaboration
Yeah.
with other healthcare providers, whereas in home health physical therapy, I have a lot more independence as a practitioner, and I love being around the patient and their family and integrating the family into therapy sessions so that they can also push the patient to more independence.
Yeah. Oh, that's good. Yeah, I know. It whenever there's family involved. Now it's more
Mhm.
on Zoom, but when they are in the room,
Mhm.
they're such motivators in keeping our patients up with their, therapies, with their medications, and with education. You know, even when you think of times when you're a patient, you kind of don't always remember everything that the doctor says. And so to have like an extra person there, they're gonna be like, oh, they told you to do it like this. So um, I'm sure the home sessions are like really important for the patients. And it's crazy too, because we're our professions are so similar because we also can do home care too. I don't do it, but
Uh-huh.
we can, go there. We train them on their oxygen and their oxygen tanks and medications at home and different therapies and stuff like that. So it's so similar. I mean, I guess it makes sense. We're both like therapists, but
Therapist, yeah, I was like that.
um, so kind of maybe a chunkier question. What advice do you have for physical therapy students right now who are in the midst of their program and kind of struggling in terms of if they feel like this is right for them? Because I often get students asking me, like, I don't know if I can do this. I don't know if this is for me. And I feel like
Mm,
you honestly don't truly know until you're doing it. Um,
that's
but
true.
how, like, any advice for people who are questioning it? Because I'm sure you questioned if this was right for you.
Yeah, definitely. Um I think what's really cool about this period of time is that social media is um a lot more accessible, and I think like practitioners like us who have an Instagram can really give the inside scoop of how the everyday life of being a clinician is. And like I'm sure like you can agree, like there's still like good days, and like there's also like not so good days.
Yeah.
So that's like completely normal. But my advice would be to look into exactly what is your purpose of going into your particular profession. And if you can go back into that reasoning, and oftentimes it's like a really noble reasoning. Like you want to help people, you want to improve their, for me, improve their mobility.
Yeah.
You want to help someone move who hasn't been able to move for 2 3 weeks, and give them a sense of independence. I mean, that's like a really powerful feeling, and it's a really powerful gift to give to people. So my advice would be just to look back at the reasoning why, as to why you wanted to go into the profession, firsthand, and really hang on to that. Especially during school when you're just like
Yeah.
studying, you kind of forget that you're studying for people, you're studying for patients. So I would say, yeah, like go back to the people, go back to the patients and the purpose of everything.
I love that. I I think I heard this from someone when I was a student, but
Mhm.
somehow I came across that same like type of meaning where when I was struggling or when I was just so tired of school or if I was kind of studying something and I just wasn't interested in it, I always thought, okay, this is something I'm gonna need to know for somebody else, like this is to better somebody else's life. Like this is someone's life is in your hands, this is caring for someone else. Like you have to know this, you have to study this, and you have to like obviously sometimes you're not going to want to study, but you're going to have to like have that drive to help people and to be a people person. I think it's okay if you're shy, um, but you also have to kind of come out of your shell. And I think that that just comes with time. I think if you're interested in the career and if you look it up and you do the best of your abilities to like look it up. I know there's not a lot of like shadowing available, especially nowadays. But like you said, it's so different than when even when I started schooling, there was like maybe two RTs on YouTube who like didn't really post that much. And
Right.
now there's like so many RT accounts and it's just I'm sure just like you, I wanted to be like the person that I was trying to find as a student. So I'm sure like so many people appreciate your Instagram and your content and your feed and look up to you and I'm sure message you and everything. So um, thanks for like, being a voice for other people and inspiring other people.
My gosh, thank you.
Yeah. Okay, so we are almost done. I just have a couple more questions. Um, where do you see yourself in like the next 5 to 10 years? Like, what do you want to be doing? What are your goals, your aspirations?
Right.
Hard
Uh,
question.
I
No.
know. But thankfully, this was asked earlier, so I do kind of have an understanding of where I want to kind of move forward. I definitely would like to step into some kind of role of academia. I really like, I don't know, I like teaching about what physical therapy is. It
Mm,
just really excites me when I can just share a simple thing on my Instagram and
yeah.
there's like students that are like, oh my gosh, like I'm learning that in class literally right now. And it's like so exciting to me when people can like like merge their classroom and experience stuff and like align the dots together. Like I
Yeah.
think that's really exciting, and I just like love talking to students. So definitely, hopefully, in 5 years, I do some form of academia, whether it's like just being a TA in a lab for some PT school. Like I would be happy with that, as well as still doing my patient care. Um, and yeah.
I love that. I feel like I'm the same way. Like I love to teach and I love like getting feedback on like, oh my gosh, like I didn't really understand that before. Now it makes sense. Or, like the clicking. But I don't know, the idea of being a teacher, like I don't know if I want to be a teacher, but I like to teach. You know what I mean? I don't know. But I'm not crossing it off my list. Who knows? You never know.
Right. You might love it.
Yeah, you never know. Well, I just wanted to say thank you so much, Veronica. You are so sweet and so inspiring. And I just, I would love to work with you. You just seem like so fun and sweet and nice. And yeah, thank you everybody for watching. You can follow Veronica at this PT Life on Instagram, and you can follow me, Gary RT on Instagram, or Gary RT on YouTube, whichever you're watching this on. Go to the other one. If you like this video, please hit the like button, subscribe for more videos showcasing other professions. And yeah, thank you so much. I appreciate it. Coming up, I have like nurses, I have some other respiratory therapists. Here we had physical therapy, and I think I have like a dentist and a veterinarian, and just other professions coming up. So it's going to be super exciting. And thank you again, Veronica. I appreciate it. Okay, bye.
Bye. Thank you.